Pseudomonas. Pseudo who? Pseudomonas. What is that? Well, my name is Matt Cash. I'm a lymphedema therapist with Lilly Clinic in Roanoke, Virginia. And Pseudomonas is something that you want to be aware of if you have lymphedema in your lower legs and you suffer from venous insufficiency with venous ulcerations or wounds. Pseudomonas. Why do I want you to know about this? Because as a lymphedema therapist, I see Pseudomonas quite frequently. And what I've learned over the past 8.5 years of being a lymphedema therapist is that I see it, but that doesn't necessarily mean primary care physicians are able to recognize it. In fact, I've had patients that have been at a wound center for a month with Pseudomonas and it's gone unrecognized. But when you are doing the work that I do and you're working with lymphedema with wounds associated with it, with drainage, you learn a lot about how wounds behave, especially when the therapy that you're providing is supposed to help those wounds. And when it's not, there's a red flag. And Pseudomonas is one of those red flags. So here's your warning. I am going to show a photo. It's not a pleasant photo. So if you don't want to see it and you don't want to learn about Pseudomonas, scroll on. Pseudomonas. 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 I didn't win the spelling bee, nor would I if you know me, believe me. Pseudomonas is an organism that thrives in moist environments. Guess what's a moist environment? A venous ulcer or a venous wound, because it's heavily draining typically. So it's the perfect place for Pseudomonas bacteria to grow. Patients with lymphedema or chronic venous insufficiency are particularly vulnerable because the swelling and the fluid buildup in the tissues impair the immune defense system, your lymphatic system. And what happens as a result of that is bacteria has a greater chance to grow. And one of those bacteria is Pseudomonas. One of the classic signs that clinicians see first is green staining. Look at this bandage, how green it is. Here's a wound. Look how green that is. And behind me is another wound with Pseudomonas that is extremely wet. Extremely wet. A lot of drainage. Copious amounts of drainage. Sometimes there's a sweet or fruity smell that comes with this infection, but not always. It doesn't have to be. But the tell is copious amounts of drainage and this green draining. Pseudomonas doesn't always mean the wound is severely infected. It often just represents some bioburden or colonization. But when bacterial load becomes too high, it can slow healing. As a lymphedema therapist that deals with wounds, when wounds aren't healing like they should, that's a red flag for me. And when I see this green, Pseudomonas. Pseudomonas. It also not only delays the healing process, but as mentioned, copious amounts of drainage. Copious. Doesn't matter what you put on this, it's draining through. That is another red flag. This is damaging healthy tissue. That excess fluid on healthy tissue becomes damaged, the wound grows. Management focuses on reducing the bacterial burden while addressing the underlying cause of the wound. This may include appropriate wound dressings, bandages, debridement when indicated, and compression, which is what we do. But when you have Pseudomonas, you have got to have the Pseudomonas treated, because if the Pseudomonas, that bacteria, is not treated with antibiotics, then it continues to grow. And if it continues to grow, the wound continues to grow. And if the wound continues to grow, you're not getting better. And you become at a very high risk of further infection like cellulitis and sepsis and further wound development. Why do I want people with lymphedema to understand what Pseudomonas is because I've seen too many times it's going unrecognized in medical offices. And unfortunately, people get to me, a therapist, not a doctor, a therapist, but I deal with wounds. So when I see this, I know it. But there's still, patients must advocate for themselves to get the care that they need. If you are draining heavily and it's green, you need an antibiotic. And if you don't get it, request a culture, because the culture is going to come back and say, you need an antibiotic. Pseudomonas. Know it, learn it if you have lymphedema of the lower extremities. It's important. Knowledge is power.